being here. My name is Ricky Tate. I'm a registered nurse with 20 years experience, currently employed at the Alexandria VA Medical Center. My function at that facility is a staff nurse on the intensive care unit and the telemetry ward. Today I'd like to speak to you about catheter-related urinary tract infections. Did you know that a urinary tract infection can actually kill somebody? Well, as nurses and healthcare professionals, we really did know that somewhere in the back of our mind, but it's not in the forefront of our thoughts when we admit that patient or we instill a catheter in someone. UTIs are the most common healthcare-acquired infections. They account for 34.6% of all the healthcare-acquired infections. 80% of that 34.6% are catheter-related. Now, when do patients require urinary collection devices? Several things. Conditions requiring monitoring urinary output if we want an accurate intake and output, if we need a timed urine output. It could be for congestive heart failure, renal insufficiency, renal failure, post-surgical. There's several things that require accurate intake and output. Other conditions that might require a urinary catheter would be existing decubitus or wound where you do not want the wound to get infected with the urine. Possibly a surgical wound, could be a trauma, whatever it is. Chronic incontinence, and that would be to prevent skin breakdown. Also, urinary retention, that's just the inability to empty the bladder, sometimes a neurogenic bladder. Now let's look at the type of collection devices that are available. There are indwelling and external catheters. Indwelling catheters come in 4 different materials. They can be silicone, latex, Teflon, or silver impregnated. Now the silver impregnated are actually supposed to decrease the chance of infection. For most people this works, some people it does not work. Then there are the external catheters, and these are condom catheters. It's something that you use when the patient does not have a problem emptying the bladder, but you do want to keep them clean and dry. How prevalent is catheter usage in the hospitals, and what are some of the adverse effects? Well, the effects can be wide range. Studies show that 12 to 26% of all hospital patients get a catheter at some point during their hospitalization. 28% of catheterized patients develop a urinary tract infection. 10% of the non-catheterized patients develop a urinary tract infection. It also increases the antibiotic resistance because these patients have to be treated with antibiotics, and the more antibiotics you use, the more antibiotics you're treated with, the more resistant you become. Catheters also increase higher mortality rates. Studies show that during hospitalization, 6.6% of catheterized patients die versus 1.5% of the non-catheterized patients. Also, the same group was studied post-discharge. 90 days post-discharge, 25% of the catheterized patients had expired versus 10.5% of the non-catheterized patients. It also leads to longer hospitalizations. Catheterized patients showed a 6-day medium length of stay, whereas non-catheterized patients' medium length of stay was 4 days. Studies have also showed that indwelling catheters produce more infections, and up to the first onset will be 7 days. As far as external catheters, usually the onset is 13 days. So the indwelling catheter does cause more infection, and the infection comes earlier versus the external catheter. In conclusion, we'd just like to say that there are some things that nurses can do to prevent some of these things. It's really easy to see that the urinary collection devices can cause a lot of adverse effects, including and up to death. What nurses can do is to be very vigilant. We need to take the opportunity to improve patient outcomes by identifying patients who do and do not need a catheter, identifying the patients who no longer need the catheter, and alerting the physician to that. Early removal and timely discontinuance of urinary catheter can actually decrease the catheter-associated urinary tract infections. What I'm asking you today is just to be more aware. When you have a patient that has a catheter, make sure that you give them good catheter care every shift. Make sure when you're putting that catheter in that you use sterile techniques and that you monitor that patient for signs and symptoms of urinary tract infection. which would be cloudy urine, foul-smelling urine, increased temperature, pain, or burning with urination. All of these things can be signs and symptoms of urinary tract infection. So I'm just asking you today to be more aware and pass this on to your peers and the younger nurses that are coming up behind you so that we can all do a better job of giving quality care to our patients. Thank you. Are there any questions? Thank you.
Good job.